Cardiogenic shock is described as inadequate tissue perfusion resulting from cardiac dysfunction. Commonly occurs after an acute myocardial infarction, and the heart is unable to maintain adequate cardiac output. Cardiogenic shock can result from systolic dysfunction caused from the heart muscle not contracting properly, diastolic dysfunction, and is caused by the left ventricle chamber stiffness, right ventricle failure, and is caused from PEEP, pulmonary embolism, acute respiratory distress syndrome, pulmonary fibrosis, or arrhythmias. 5 to 10% of patients with acute myocardial infarction develop cardiogenic shock, higher in men than women. Cardiogenic shock is the leading cause of death in myocardial infarction patients. The key to good outcome is rapid diagnosis, prompt treatment. Some myocardial infarction syndrome to look for are squeezing, heavy sternal chest pain that radiates to the left arm and neck, and pain that's described like burning, sharp stabbing. Some signs and symptoms of cardiogenic shocks are hypotension, low cardiac output, a systolic blood pressure of less than 90 millimeters of mercury, low urine output, cool extremities, tachycardia, cyanosis, rapid faint pulse, crackles can be heard in the lungs, altered mental status, poor capillary refill. Hemodynamics are done by using a Swan-Ganz catheter, and it is helpful in ruling out other causes and types of shock. Hemodynamic measurements of cardiogenic shock are pulmonary capillary wedge pressure of greater than 15 millimeters of mercury and a cardiac index of less than 2.2. Some medications used are vasopressors in the state of low blood flow to improve cardiac contractility and blood pressure. Vasodilators are used to relax smooth muscles and improve cardiac output, and diuretics are used to decrease peripheral edema if it's present. Arterial blood gas related to cardiogenic shock is a respiratory acidosis with an elevated base deficit. Oxygenation and airway protection are critical. Intubation and mechanical ventilation are commonly required for these patients, and patients should always be treated with high flow oxygen. Pressure support ventilation will improve oxygenation, but it will affect the patient's hemodynamics. Now here is a picture of an angry heart. This yellow and black part down here represents an injury to the heart muscles, and that causes the muscle to not work properly and not pump effectively, because the heart acts like a huge pump in our body. So when the pump isn't working, there is an increase in the preload, and then because the heart is injured, it won't be able to pump the heart to the next ventricles, and then an afterload is increased because the heart is impaired and it won't be able to pump the blood throughout the body. So there will be an increase in the preload, an increase in the afterload, and a decrease in the cardiac output.